OK, at a time when vaccine mandates are coming under increasing question, there are legal challenges afoot, of course. We're going to hear a lot about this in coming weeks. And I reckon there's a serious debate to be had for the good of the country. For instance, across this country right now, there are nurses, police and teachers not allowed to work because they're not vaccinated. Yet some of the data suggests that vaccinated people might be catching and passing on the virus almost as easily as people who have been fully vaccinated, especially with the Omicron variant. But that was true, of course, with the Delta variant as well. So there's a lot of studies on that, and it questions the extent to which vaccines actually prevent you catching the disease and pass it on. Of course, we know that the vaccines are highly effective when it comes to protecting the people who are vaccinated. There's plenty of research going on to all of this, especially from variant to variant. But still, this is a live medical issue right now. I'm, of course, no anti-vaxxer. The vaccines are vital and extremely successful, beyond question, in their key task of protecting the vaccinated from the worst effects of the disease, keeping them out of hospital and keeping them alive. But if the argument is that the unvaccinated are a risk to others in spreading the disease, then we need to be sure that that argument is based on up-to-date facts and data. Medical experts on this show have been explaining that the unvaccinated are primarily, of course, a risk to themselves, especially when they're such a tiny minority in this country. There's more than 90% of us, of course, fully vaccinated. So if they want to work, the unvaccinated, then they can work and they don't present a threat to anyone else, of course we ought to be allowing them to do that work. This is a crucial debate for medical experts and politicians in the here and now. But while that's occurring, some politicians are already pushing to increase the criteria for what it means to be fully vaccinated. They reckon you now need your booster, your third shot for that.
As it stands now, if you're not double-dose vaccinated, there's a whole range of things that you can't participate in. That's a choice that you have made. It's the wrong choice. The wrong choice. And it puts at risk the health of others. It just makes sense to me that if that's good for 2 doses, and the experts tell us that 3 doses really is critically important, then those rules would logically apply for 3 doses.
Now, apparently National Cabinet, which met today, has made no decision on this, but stay tuned. Once again, I'm all on board. I've already had the booster and even my primary school kids have had their first shot. But will this make it even harder to have all the police, teachers, nurses and other people we need working on the job, especially when nurses in New South Wales are now protesting about pressure on the health system?
Okay, so the reason we're here today is because of the public. We want to tell you the truth, that our hospitals are they're unsafe at the moment. The safe staffing is not happening. Before this pandemic, we were asking for safe staffing. We were speaking to the government. We've been speaking for years to the government, asking for safe ratios. 2 years ago, we were already screaming for help, and instead of providing us with any kind of support, any resources, the government instead has expected us to keep going and really abused us.
Abused us? There has been a lot more resources thrown into health, of course, in New South Wales and in every other state around the country. Look, there's, of course, a lot of special pleading in this. The Nurses Union was demanding more resources before the pandemic, as you just heard, and now they're using the pandemic to boost their case. We absolutely admire them for the work they're doing, but of course there'll be pressure on a hospital system during a pandemic. But if there are nurses and other medical staff who are willing to work and are not fully vaccinated, we need to be very careful about rejecting their skills and services. If the medical advice firms up that they present no significant increased risk to patients or other staff, it's mainly their own health that's jeopardised by their own choice, then we need to make sure that the vaccine mandates are not doing harm to the health system, our education system or our law enforcement system, rather than protecting them. Don't forget, if there are concerns, then organisations might be able to use these people, the unvaccinated, in specific or limited roles or with specific rules for protective equipment. We're not talking about a huge number in percentage terms of these workforces, but there are reports that up to 2,000 health workers in New South Wales alone and more than 50 workers in one Melbourne hospital are not working because of vaccine mandates. I don't pretend this is easy, but it's an issue the experts need to look at very, very carefully.